All right, everybody, we are going to talk today for Daily Doc Talk about mindset around chronic pain. So one of the things that I think is important to remember if you're suffering in chronic pain, the process, the navigations, the exploring different options, all of that type of stuff, at the end of the day, it's your responsibility. And some people don't like to think like that. Some people want somebody else to make those decisions and do those things for them. And generally that's going to fall on the provider, right? And so some people might think that if you have chronic pain, that it's the responsibility of your medical care provider to give you all of the options and explore everything with you. And unfortunately, that is not the case. That's not how a lot of this happens. And a lot of people end up finding what works for them by doing their own exploration and, figuring out what works for them, what doesn't. Now, I'm not saying that the physician or healthcare provider should do nothing for you, because that's clearly not the case. We have to be careful to not get into this mindset that somebody else is going to figure this out for you. Somebody else is going to do the work. Somebody else is going to take it upon them to go down rabbit holes and figure everything else out. Because a lot of times healthcare practitioners are working with a lot of patients all at the same time. And so when I'm with a patient, as an example, the one-on-one interaction, like that has my full attention. But outside of that, when you've got a few hundred patients that you're taking care of, we can't be putting in 10, 20 hours a week looking at different options for patients. We can help teach and give tools and guides and ideas and things, and sometimes it's not enough. Sometimes we can't help people because we just don't have the time to provide that level of care for somebody because of the constraints within medicine in terms of how many people we're seeing and that type of stuff. And so this is something to think of when you're going through this process, is that you've got to take a lot of responsibility, and you have to understand that you need to work harder than anybody on your healthcare team works for you, because nobody should have to work harder than yourself. Because at the end of the day, even if you have the most outstanding physician working with you, they're really only able to devote a few hours a month to your care. You're the one who is living in your body 24/7, and you have the hours during the day to devote to taking care of yourself and to doing things that are going to benefit your chronic pain. And so this is obviously a delicate topic for many, because a lot of people feel like their doctors aren't doing anything for them. They're not trying at all. And obviously, there needs to be some level of commitment and exploration on the level of the provider, but also take into consideration that you can't just play victim to the chronic pain game. It's easy to think that you're not getting better because your doctor's not doing enough. And I've had a lot of people come tell me that, and that is an interesting topic, one that I admittedly have not explored fully enough yet to better understand how to help those people the most, but on occasion have had many patients discuss this, whether it's with myself or it's with another provider, where they feel that they are not getting better because their doctor is not doing enough for them. And that is playing a victim card, and you're saying that my external circumstances are the reason that I'm not getting better. Somebody else's choices are why I'm not getting better. If you have the mindset that somebody else's choices, which you have no control over, are the reason that you're not feeling well, the reason that you're still in chronic pain, you've instantly just lost all control. And your brain knows that. If you truly believe that you are not getting better because of somebody else, your brain is automatically not going to look for things in its environment to help you get better, because it has lost control. It has given up control to somebody else. But the second that you take ownership of your healing, your chronic pain, you can then start to see things in your environment differently that are going to shift that healing mindset, which can actually shift your healing, because you've now taken ownership to say, no, the food that I'm putting in my body, the lack of sleep that I'm getting, the choices that I'm making on a day-to-day basis are impacting my body's ability to heal. And I need to take ownership of it, that I have not done a great enough job in the past, and I can do better because I want to be pain-free. Just something to think about as you're going through this chronic pain journey. My heart breaks for every single person, but please, please move out of the victim mindset and take ownership, because that's the only way that you're going to start to break out of that mold. Because victims of chronic pain generally do not get better, and people who take ownership of the chronic pain and take steps and actions are the people who do get better. All right, see you later.